Do you think the cause of all eye problems or symptoms lie within the eye? May not be. It may be somewhere else, like in the brain, like in Carotido-Cavernous Fistula. What is it? Imagine that you wake up in the morning and you find your eyes swollen, red, and it seems to beat with every heartbeat. It is one of the warning signs of a rare but serious condition, that is Carotido-Cavernous Fistula. So what is Carotido-Cavernous Fistula? So to know that, we need to know about two structures. One is carotid artery, the second one is cavernous sinus. The carotid artery is a major artery that carries blood from the heart to the brain under high pressure and runs through the skull just behind the eye. Next to the carotid artery is this venous chamber called as cavernous sinus, and which is under low pressure and drains the blood from the brain as well as the eye. So the Carotido-Cavernous Fistula forms whenever there is an abnormal connection between this artery, carotid artery, and the cavernous sinus. Eventually what will happen is that high pressure blood gushes into this low pressure venous chamber, leading to venous hypertension symptoms. Why does it happen? The CCF happens after head injury, either after road traffic accident or a fall from height, and uncommonly, but it happens spontaneously also, especially in elderly people, people having weak blood vessel walls, and people with high blood pressure. All of them can have a spontaneous CCF. In either way, the result is the same, that is high blood pressure in the veins of the eye. So what are the symptoms of CCF? Because the veins of the eye are not designed to sustain high blood pressure, there are several symptoms that can happen with CCF, including congestion of the eye, redness of the eye, and the eye may get bulged out. There may be pulsations within the eye which synchronously can happen with the heartbeat, and you may have blurred vision or double vision, and vision may be compromised or permanently lost if there is delay in treatment. So CCF, how it is diagnosed? Doctors suspect CCF based on certain clinical signs and symptoms, and investigations like CT and MRI may show enlarged eye veins, which may be very conspicuous or very subtle. But the gold standard is DSA, that is digital subtraction angiography, in which that communication between the artery and the vein is demonstrated very nicely. The good news is that CCF is highly treatable. Although the condition is related something to the brain, it doesn't require any cutting of the skull or major incision into the brain. It is done in a very minimally invasive way. It is done by passing small catheters. The doctors pass small catheter either from the wrist or the groin, and they pass it under the X-ray guidance into the brain blood vessel, and they visualize under the X-ray guidance where is the hole between the artery and vein, and they try to seal that particular hole with the help of metallic coils or liquid glue. And if it is done properly under expert guidance, the function of the brain is well preserved. Patient will be discharged usually on the next day. And the swelling of the eye condition usually resolved within next 1 or 2 weeks. And on follow-up scans also you can see the treatment effect, like resolution of the pressure within the eye veins. Thank you.